Welcome, I'm Dr. Lori Keynes, and I will be teaching you today about the vital signs. The vital signs are called vital signs for a reason. They're vital, they're very important to do. Many times you'll notice that a medical assistant or a nurse might take vital signs before you actually see the patient. I would recommend, especially early in your career, that you repeat the vital signs yourself. Number one, it's good practice, and number two, it's also important if you're considering making medication changes or treatment decisions based on vital signs. It's always good to take them yourself so you have firsthand knowledge of what they are. So let's get started. Today's objectives are: the student will be able to demonstrate how to perform each vital sign using proper technique and state normal ranges for each vital sign in adults. The 4 vital signs are blood pressure, pulse, respiratory rate, and temperature. Always remember to wash your hands and clean your stethoscope with an alcohol pad before examining a patient. So now let's talk about the equipment. This is called a sphygmomanometer, also known as a blood pressure cuff, which is much easier to say, so that's how we'll refer to it from now on. Basically, you want to make sure that the cuff is the appropriate size. Now, most blood pressure cuffs have a very nice feature. They have an index, usually right along here. Most of them say index here. This one does not. But this is what you want to make sure lines up in the range, okay? And the range is usually on the reverse side of the blood pressure cuff. So when you put it around the patient's arm, you want to make sure that the end of it falls between the range. This tells you that the blood pressure cuff is the correct size. Size is actually very important. If you have a cuff that's too small for a patient, it's actually going to overestimate the blood pressure. If you have a cuff that's too big for a patient's arm, then it might falsely underestimate the blood pressure. Okay, so you need to make sure the cuff is the right size. Moving over to this point, most blood pressure cuffs also have a marker for where the artery, where you should line this up with the brachial artery. Okay, so that's pretty straightforward. You want to place this about 2.5 centimeters above the antecubital crease. Okay. Once you have your blood pressure cuff on the patient, your next job is going to be to use the bulb. This is called the inflation bulb. Okay. When you're pumping up to inflate the bulb, you want to make sure that this knob is turned all the way to the right. You want to make sure that you don't turn it too firmly, because remember, when you're deflating, you'll only be using 2 fingers, your thumb and your second finger, and you're going to be using both of those to deflate slowly. Okay, so make sure you turn it to the right when you're inflating, but don't turn it too tightly. Now let's talk about how to actually take the blood pressure. Once you have the appropriate size cuff, you're going to place it on the patient 2 to 3 centimeters above the antecubital crease. You're first going to actually palpate the radial pulse and inflate the bulb while you're doing it. When you feel that the radial pulse is no more, you're going to quickly deflate the blood pressure cuff. You then want to turn the knob to the right again and inflate 30 millimeters of mercury above where you felt the radial pulse disappeared. For example, if the patient's radial pulse disappeared at 100, you're going to pump the cuff up to 130 millimeters of mercury. You're then going to want to turn the knob to the left slowly and deflate about 2 to 3 millimeters of mercury per second. When you hear 2 consecutive beats, that's the systolic blood pressure. Keep listening. At some point, there's going to be a little muffling, and then you're going to hear the disappearance of those sounds. The disappearance of the sounds is the diastolic blood pressure. You want to go about 10 millimeters of mercury after you hear the disappearance of sounds, just to make sure you were accurate in where you thought they disappeared. Just for your reference, a normal blood pressure is 120 over 80 or below. Blood pressures in the range of 120 to 139 over 80 to 89 are considered pre-high blood pressure, and values over 140 or above, over 90 or above, are considered hypertension. Here are some tips you might want to think about before you take the blood pressure. You want to make sure that the patient is seated for about 5 minutes in a quiet room. Their legs should be uncrossed and their feet should be on the floor. It's ideal if the patient hasn't used any tobacco products or caffeine products about 30 minutes before you're taking the blood pressure. and you want to make sure that you actually look at the skin of the arm to make sure it's okay to actually take a blood pressure in that arm. For instance, you wouldn't want to take a blood pressure if a woman had breast cancer and had lymph node removal on the right axilla, because patients can sometimes have something called lymphedema, and it's not good to take a blood pressure in that arm. The same is true if a patient is on dialysis and has an AV fistula in the arm. You never want to take a blood pressure in the arm with the AV fistula, so it's important to take a look at the arm before you do a blood pressure check. Here's a demonstration of me doing a full blood pressure measurement. Hi Teresa, I'm Dr. Keynes.
Hi, Dr. Keynes.
It's nice to meet you. You want to enter the room, introduce yourself, and ask the patient if it's okay if you take their blood pressure. When you're taking a blood pressure, you want to make sure there's no clothing on the arm, and you also want to make sure to examine the arm for any abnormalities. Now you should apply the blood pressure cuff about 2.5 centimeters above the antecubital crease. The next step is to place your fingers over the radial pulse. Turn the dial to the right and pump up until you don't feel the pulse anymore. Remember to keep a mental note of what that pressure is and quickly deflate the cuff. The next step is to support the arm at heart level. Place the bell of your stethoscope over the brachial artery. Turn the dial to the right and pump the cuff up to 30 millimeters of mercury above which the radial pulse disappeared. Now turn the dial to the left and slowly deflate. Your systolic blood pressure will be when you hear 2 consecutive beats. Continue to listen until the disappearance of sounds, which is the diastolic pressure.
Thank you.
Some more tips when taking a blood pressure. You want to make sure to check the blood pressure in both arms. There are some abnormalities where you can have discrepancies in blood pressure between the right and the left arm. We'll learn about those a little bit later. You also want to avoid repetitive cuff inflations, as that can cause venous congestion and give you abnormal blood pressure readings. We already discussed where to feel the radial artery. You want to use the pad of your index and middle fingers. In clinical skills, we recommend that you take the pulse for 15 seconds and multiply by 4 to find beats per minute. That's the pulse rate. If you have an irregular pulse or a pulse that's very fast or very slow, you may want to feel for the full minute to make sure you get an accurate reading. A normal pulse is between 60 and 100 beats per minute in an adult. Less than 60 is considered bradycardia, greater than 100 is considered tachycardia. In addition to the rate, you also want to note the regularity. If you note an irregular pulse, you want to try to see if there's a pattern. When you're checking a respiratory rate, you don't want to alert the patient you're monitoring their respiratory rate. This is because often patients stop breathing or breathe irregularly when you tell them that you're watching them breathe. One respiratory cycle is counted as one rise and fall of the chest. You can see the patient here, their chest rising and their chest falling. That's counted as one cycle. Ideally, you want to count over a minute, but oftentimes we don't have that much time. And if a patient is breathing normally, it's adequate to watch for 15 seconds and multiply by 4 to get respiratory rate per minute. A normal respiratory rate is 14 to 20 respirations per minute. In addition to the rate, you want to notice the depth of their breathing, the rhythm of their breathing, and the effort of their breathing. Temperature is a very easy vital sign to take. You want to make sure to use a new probe cover for each new patient. There are 4 sites you can take a temperature. The first site is an oral temperature. That's probably the most preferred. Normal is 98.6 degrees Fahrenheit. But there is a range to that, so anywhere from 96.4 to 99.1 is considered normal. The oral temperature can be inaccurate if you have a patient who just had something to drink, eat, or they just smoked a cigarette within 10 to 15 minutes. Oral is a preferred way to take a temperature, but if a patient is unconscious or they can't follow directions for whatever reason, maybe they're a newborn and they can't actually close their mouth, then you really can't take an oral temperature. Your other options are tympanic, and that involves inserting the thermometer actually into the ear, and you point the probe towards the tympanic membrane or the eardrum. The only problem with that is if a patient has a lot of wax, it can obscure the tympanic membrane and give you an inaccurate reading. The rectal temperature is not the most preferred way to monitor temperature, but you do need to use it in certain scenarios. It's a core body temperature, so it gives you a very accurate reading. We use it in newborns who have fever, and we also use it in patients who are hypothermic and we need an accurate reading. And the axillary temperature is probably the least accurate way to do it. It's very commonly used in the hospital because it's quick. You essentially just insert the probe underneath the patient's armpit, and it's usually about 1 degree Fahrenheit less than the oral temperature. So hopefully now you feel comfortable with the technique of how to take the vital signs. You'll need some opportunity to practice. We'll do that in the launch, and I encourage you all to practice doing these at your click sites in the future this year. I thank you for watching, and if you have any questions about anything that we discussed today, feel free to email me. Thank you.